Hello, how are you doing? Okay, so today's our first session, and I want to do posture analysis on you first before we start any weight training. So this is to identify whether you have any areas that are risky to do any of the weightlifting exercises. So let's check your upper cross syndrome first. So I'll be checking whether your head was too forward most of the time when you're in a normal standing position. Maybe your back, your scapular area, there is the prominent medial border showing. And also whether you are kyphotic. So that's the excessive curvature on your back. I guess most of us say, whether you have a hunchback. Okay. Then we have a fourth one, and this will be the distance between the scapula and the thoracic spine. It should be around about 3 fingers for a normal distance. And then I will also check whether you have a prominent inferior angle. So later on I'll be checking that out by sweeping your back. And lastly, we have number 6 is checking for your rounded shoulders as well. So I'm going to check where your palms are facing in my test. Okay. Then we go to the lower cross syndrome area. So this will be your checking your hyperlordotic lumbar and making sure the curve is not too excessive also. Then there is your hyper knee extension, which is to see whether your knees can actually point behind you, which seems to be not normal. Okay. And then we have also to check your anterior pelvic tilt as well. Okay, so that's the lower cross syndrome. Then we got the pronation. So what the pronation area is, I will be checking on your Achilles heel aligned with the calcaneus bone, the heel bone area at the back. There's also going to be checking on your pronation, whether you have that arch at the bottom of your feet as well. Then I will be able to check on the angle of your toes for not valgus knees, hallux valgus. Okay, and then after that I'll check from your anterior on your valgus knees to see whether you have the turned in legs, making it kind of like an X shape. Okay. What we got for so our fifth one's gonna be the anterior pelvic tilt. So we'll be seeing whether your whole upper body is actually put forward a little bit. Okay, so if it's at a forward angle, it's gonna strain quite a lot of muscles everywhere. All right. Then we got the scoliosis, and the scoliosis I'll be checking as well whether your spine is properly aligned or whether it's got a bit curved with a C shape, or sometimes people may even have an S shape. Okay, so that's the scoliosis, and then I'll be able to check your lateral lateral pelvic tilt. Okay, so I'll be checking from your back on this one to see whether you are actually leaning onto the left or the right side, or you're actually pretty balanced where your pelvis area is, your posterior, superior, iliac spine area. Okay, then I will go up to your shoulder area and check whether your shoulders are slightly elevated or maybe depressed at all, and yeah, whether it's tilting again to one side or not. And lastly, there's also your head. Since it's a pretty heavy part of the body as well, we want to make sure that it is balancing and aligned. Okay, thank you.